Many men over 50 notice subtle changes in energy, sleep, and circulation, but they often assume it is simply part of getting older. In reality, some everyday habits may influence these changes more than people realize. Tonight, I want to explain what happens inside the body as men age, and why small lifestyle patterns can gradually affect recovery, movement, and overall wellness. I'm Dr. Hina Kim, and this is an important conversation many men are not having early enough. Good evening. I'm Dr. Hina Kim from Dr. Hina Kim Men's Sexual Health. Today I want to talk about something many men notice after the age of 50. Changes in circulation. Changes in energy. Changes in physical recovery. And changes in how the body responds during daily life. This is a very common part of aging. Blood flow naturally changes over time. The blood vessels become less flexible. Muscle mass slowly decreases. Sleep patterns may become lighter. Stress hormones can stay elevated longer. All of these factors influence circulation. Many men think circulation only matters for the heart. But healthy blood flow supports the entire body. It affects the brain, the muscles, the skin, the joints, and overall physical energy. One of the first things I discuss with patients is movement. After 50, long periods of sitting can affect circulation more than many people realize. Even short walks during the day can support healthy blood movement. Simple daily movement matters. Not extreme exercise. Not intense training. Consistent movement. Walking after meals may help support metabolic health. Light resistance training may help maintain muscle tissue. Stretching may help support mobility and posture. These small habits often become more important with age. Sleep is another major factor. Poor sleep can influence hormone balance, stress response, and recovery. Many men in their 50s wake up more frequently during the night. Some notice lighter sleep. Others feel tired even after several hours in bed. This can affect daytime energy and circulation over time. A consistent sleep schedule may help support better recovery. Limiting heavy meals late at night may also help some men sleep more comfortably. Reducing late evening screen exposure may support more natural sleep rhythms. Nutrition also plays an important role. The body continues to need protein, hydration, fiber, vitamins, and minerals as men age. But eating habits often become less structured during busy adult life. Some men skip meals. Some rely heavily on processed foods. Some do not drink enough water during the day. Hydration matters for circulation. So does balanced nutrition. Colorful vegetables. Lean proteins. Healthy fats. Whole grains. And consistent meal timing can support overall wellness. Another important topic is stress. Chronic stress can influence sleep, blood pressure, and physical tension. The body does not always recover from stress as quickly after 50 as it did earlier in life. That is why recovery habits become more important with age. Quiet time. Regular movement. Adequate sleep. Healthy social connection. And time away from constant stimulation. These habits support long-term health in many ways. I also encourage men to pay attention to breathing patterns. Shallow breathing during stress may increase physical tension. Slow breathing and relaxation practices may help support overall calmness and recovery. Alcohol and smoking can also affect circulation over time. Even moderate lifestyle choices can gradually influence vascular health as the years pass. This is why preventive care matters. Routine medical visits become increasingly important after 50. Monitoring blood pressure, blood sugar, cholesterol, weight changes, and sleep quality can provide useful information about overall health. Many men ignore early body signals because they believe aging automatically means feeling worse every year. That is not always true. Healthy aging is often connected to consistent daily habits. Small decisions repeated over time can influence how the body feels and functions. Another thing I discuss often is recovery speed. After physical activity, the body may need more time to recover than it did in the 30s or 40s. This is normal. Recovery is part of healthy wellness planning. Overtraining without recovery may increase fatigue and physical stress. Balanced activity is usually more sustainable long-term. Many men also notice changes in body composition after 50. Muscle may decrease gradually if strength activity becomes less frequent. At the same time, abdominal weight may increase more easily. This combination can affect energy and movement comfort. That is why regular activity and nutrition become closely connected during this stage of life. Consistency is often more valuable than intensity. A sustainable routine is usually easier to maintain over many years. And long-term consistency is one of the most important parts of healthy aging. Men who maintain simple daily routines often report more stable energy throughout the week. That stability becomes valuable with aging. The body responds well to rhythm and consistency. Regular wake times, regular meals, regular movement, and regular sleep habits. These routines may help support the body's natural recovery systems. Another important factor is posture and mobility. Many men spend years sitting at desks, driving, or remaining inactive for long periods. Over time, reduced mobility may affect circulation and physical comfort. Tight muscles and reduced flexibility can also influence movement patterns. Gentle stretching in the morning or evening may help support mobility. Even a few minutes each day can become beneficial over time. Breathing during movement also matters. Holding the breath during physical effort may increase tension unnecessarily. Controlled breathing may help support more comfortable movement and recovery. I also encourage men to pay attention to hydration earlier in the day instead of consuming most fluids late at night. This may support daytime energy while also helping reduce sleep interruptions for some individuals. Caffeine habits are another area worth reviewing. Some men rely heavily on caffeine because of fatigue or poor sleep quality. But excessive caffeine later in the afternoon may interfere with nighttime rest. This can create a cycle of lower energy and disrupted sleep. Moderation is important. Balanced energy habits are usually more sustainable than depending on stimulants throughout the day. Weight management also becomes more connected to circulation as men age. Extra abdominal weight may place additional strain on joints, sleep quality, and metabolic function. Small nutritional adjustments over time may support gradual improvements in overall wellness. Extreme dieting is often difficult to maintain. Steady habits are usually more practical long-term. Protein intake also deserves attention after 50. Muscle maintenance becomes increasingly important with age. Muscle tissue supports strength, balance, posture, and metabolic health. Including adequate protein throughout the day may help support healthy aging. Recovery after exercise may also improve when nutrition and sleep are consistent. Sunlight exposure during the daytime may support natural sleep cycles as well. Many adults spend most of the day indoors. Natural light helps regulate the body's internal timing system. Even brief outdoor walks may help support daily rhythm and mental clarity. Mental health and physical health are closely connected. Chronic stress and mental fatigue can influence sleep quality, appetite, and energy levels. That connection becomes more noticeable for many men after midlife. This is why overall wellness should not focus on only one area of the body. Healthy aging usually involves multiple daily habits working together. Movement, nutrition, sleep, stress management, hydration, and preventive healthcare. These areas influence one another continuously. Another topic that becomes increasingly important after 50 is recovery from inactivity. Even a short period of reduced movement can sometimes lead to stiffness and lower energy more quickly than before. That is why regular gentle activity often matters more than occasional intense activity. Consistency supports circulation more effectively than short bursts followed by long inactivity. Joint comfort also deserves attention. Low-impact movement may help support mobility while reducing unnecessary strain. Walking, light cycling, swimming, And controlled resistance exercises are often easier to maintain over time. The goal is not perfection. The goal is supporting long-term function and quality of life. Many men also underestimate the importance of sleep environment. Room temperature, noise levels, late-night screen exposure, and irregular schedules may all affect sleep quality. Small environmental adjustments may help support more restful sleep patterns. Even evening meal timing can influence overnight comfort and recovery. Large heavy meals immediately before bed may affect digestion and sleep quality for some men. A calmer evening routine may help the body transition toward rest more naturally. As men get older, the body often responds better to gradual healthy routines than to aggressive short-term changes. Sustainable habits are usually easier to continue consistently over many years. The nervous system also changes gradually with age. Some men notice increased sensitivity to stress, disrupted sleep, or longer recovery after mentally demanding days. Mental fatigue can influence physical energy more than many people expect. That is why rest should not only mean sleeping. Recovery can also include quiet time, reduced stimulation, and periods away from constant information and noise. The body benefits from balance. Late-night stress exposure may affect sleep quality as well. Continuous screen use before bed may keep the mind more alert during hours when the body should be preparing for rest. Creating a calmer nighttime routine may help support more consistent sleep patterns. Temperature regulation may also feel different after 50. Some men notice becoming more sensitive to heat or poor sleep environments. A cooler sleeping environment may help improve overnight comfort for some individuals. Morning stiffness is another common concern. Reduced overnight movement and natural joint changes may contribute to stiffness after waking. Gentle movement early in the day may help the body loosen gradually. This does not require aggressive exercise. Simple mobility work and walking can be enough to support circulation and flexibility. Many men also ask about energy fluctuations during the afternoon. Large meals, dehydration, inconsistent sleep, and prolonged sitting may all contribute to daytime fatigue. Balanced meals with protein and fiber may help support steadier energy levels during the day. Skipping meals and overeating later at night may create additional strain on sleep and digestion. Digestive health also becomes more important with aging. Fiber intake, hydration, and regular meal timing may support digestive comfort and metabolic wellness. The gut and overall health are closely connected. Some medications may also influence energy levels, sleep quality, hydration, or circulation. That is why regular discussions with healthcare professionals remain important as men get older. Preventive care is not only about treating illness. It is also about monitoring changes before they become larger concerns. Routine health screenings may provide useful information about cardiovascular health, metabolic function, and sleep quality. Many men delay medical appointments because they feel functional enough to continue daily routines. But early awareness often supports better long-term health management. Another important area is balance and stability. Muscle strength and coordination naturally change with age. Maintaining lower body strength may support mobility and reduce physical strain during daily activities. Even basic movements such as standing from a chair, climbing stairs, or carrying groceries rely on muscle coordination and circulation. These are important parts of long-term independence and quality of life. Regular walking remains one of the most practical forms of movement for many men over 50. It supports circulation, joint mobility, and cardiovascular wellness. It may also help reduce prolonged sitting time, which has become increasingly common in modern lifestyles. Breathing quality during sleep is another topic worth discussing. Some men experience disrupted breathing patterns during the night without fully recognizing it. Poor sleep quality may contribute to daytime fatigue, reduced focus, and lower recovery capacity. Snoring, frequent waking, and excessive daytime tiredness may be useful topics to discuss with a healthcare provider. Healthy aging involves paying attention to patterns rather than ignoring gradual changes. The body often gives small signals over time. Reduced stamina, lower recovery speed, interrupted sleep, or increased fatigue after ordinary activities. These changes are not necessarily reasons for panic, but they are useful reminders to review daily habits and overall wellness routines. Healthy circulation is closely connected to overall lifestyle patterns accumulated over many years. Daily choices matter, not because they create instant change, but because the body responds gradually to consistent habits over time. That gradual process becomes increasingly important after 50. Inflammation is another topic that becomes increasingly relevant with aging. The body naturally changes over time, and long-term lifestyle patterns may influence how the body responds to physical stress. Nutrition, sleep quality, activity levels, and stress management all play roles in overall wellness. Highly processed foods and irregular eating habits may leave some men feeling more sluggish during the day. Balanced meals with adequate nutrients may support steadier physical function and recovery. Meal timing can also influence energy patterns. Very large meals may sometimes contribute to heaviness and fatigue afterward. Smaller balanced portions throughout the day may feel more manageable for some individuals. Protein distribution during the day may also support muscle maintenance and physical stability. Aging does not mean physical decline must accelerate rapidly, but the body usually responds better to supportive routines than to neglect over long periods. Mobility should also remain part of healthy aging discussions. Joint stiffness can gradually reduce willingness to stay active, and reduced activity may then contribute to further stiffness and lower circulation. This cycle can become increasingly noticeable after 50. Gentle daily movement may help interrupt that pattern. Even standing more frequently during the day may support circulation and posture. Many men underestimate how long uninterrupted sitting affects the body. Remaining seated for extended periods may contribute to stiffness, lower energy, and reduced physical comfort. Simple movement breaks throughout the day may help support circulation. Breathing quality during physical activity is also important. Some men unintentionally hold tension in the shoulders, neck, and jaw during stress or exercise. Relaxed breathing and posture awareness may help reduce unnecessary muscular tension. Recovery habits should also continue throughout the week rather than only on weekends. The body often responds well to consistency instead of cycles of overexertion followed by exhaustion. Hydration becomes increasingly important during warmer weather and physical activity. Some men naturally feel less thirst with age, which may contribute to mild dehydration without realizing it. Adequate fluid intake may support circulation, cognitive function, and overall energy. Sleep depth may also change gradually during midlife and beyond. Some individuals spend enough hours in bed but still wake feeling unrest. This may relate to sleep interruptions, stress, environmental factors, or inconsistent sleep routines. A quiet and predictable nighttime environment may support deeper rest. Reducing stimulation before bedtime may also help the nervous system settle more naturally. Healthy circulation is influenced by both daytime and nighttime habits. What happens during the evening often affects how the body feels the next morning. Late-night eating, prolonged screen exposure, irregular schedules, and poor sleep habits may gradually influence energy and recovery. The body benefits from routine signals that encourage rest and recovery. Appetite regulation may also change with age. Some men notice increased cravings for convenience foods during stressful periods or after poor sleep. This connection between sleep and eating patterns is very common. Poor sleep may influence hunger signals and daytime food choices. That is another reason why sleep quality remains foundational to overall wellness. Maintaining social connection is important as well. Isolation and chronic stress may affect emotional well-being, motivation, and daily routine consistency. Healthy aging is usually supported by small daily habits practiced consistently over time. Good sleep, regular movement, balanced nutrition, hydration, and stress management all work together to support overall wellness. Paying attention to gradual changes in energy, recovery, and circulation can help men stay more connected to their long-term health. Routine medical checkups and preventive care also remain important as the body changes with age. Thank you for spending this time with me today. I'm Dr. Hina Kim from Dr. Hina Kim Men's Sexual Health and I'll see you again in the next discussion.